The growth of interventional cardiology over the last several years has been exponential. Not only have technologies that have existed for many years evolved to be better, more long-lasting, there are also newer technologies that are invented and advanced every year. Some of the things that are, most recently hit the field of interventional cardiology are novel ways of dealing with heavily calcified coronary arteries, specialized balloons and devices to remove that calcium from the blood vessel and make it easier for us to stent the vessel open. And so how do we here at Cross County Cardiology individualize our treatment plans for each individual patient? No two patients are the same. No two patients' disease are the same, and no two patients' goals are the same. So really when it comes to patients with coronary artery disease and treating them, it's a discussion between the doctor, myself, and the patient to learn what your goals are and to learn how I can help you achieve those goals, whether that's through medications, procedures, or usually a combination of the two things. How does a preventative approach complement interventional cardiology in managing heart health? I usually tend to think of prevention in two phases. There's primary prevention, which is preventing a disease before it ever starts. And unfortunately, by the time a person has seen someone like me, an interventional cardiologist, we've kind of missed the boat in some cases on that. But secondary prevention is the prevention of the escalation of the disease or the worsening of the disease. Once we've done a procedure or started a patient on medications to treat their coronary artery disease, it's always important that the patient working with us manage their risk factors, specifically hypertension, hypercholesterolemia, obesity, smoking, if that's applicable, in order to prevent coronary artery disease from progressing. For patients for whom interventional procedures are appropriate, it's a huge advantage that our patients, even the same day, are feeling better and can go back in some ways to their normal life. The recovery after an interventional cardiology procedure is usually very quick. By the next day or two, patients are back at work doing the things they love doing. So what role does education play in the outcomes of patients after interventional procedures, and how do we encourage patients to be fully engaged in their care? No matter what we do in interventional cardiology, nothing is perfect and nothing is perfectly long-lasting, and it takes heavy lifting on the part of the patient just as much as on part of the doctor to make sure that anything we accomplish with a procedure or with medications is long-lasting. The first part of that is obviously educating our patients on ways that they can help improve their coronary artery disease and prevent it from getting any worse. We have a lot of resources available on our website and our various social media platforms that attempt to educate our patients on things like blood pressure control, cholesterol control, weight management, exercise, and diet in the hopes that we can prevent any worsening of coronary artery disease.